My name is Lizzie, I'm a neurophysio with PhysioFunction and I've worked with them for about 6 months. Neurophysiotherapy is a specialised form of physiotherapy working with patients who have got disorders of the central nervous system, which is essentially your spinal cord or your brain. That can be due to conditions such as a stroke, multiple sclerosis, Parkinson's disease, motor neurone disease, or something like a head injury. Essentially, neurophysiotherapy works by trying to rewire or reroute those pathways in the brain that have been damaged to enable the messages to get from the brain down to the muscles in order for them to work for a task such as walking or sitting to standing. Neurophysiotherapy is different from, say, musculoskeletal physio in the fact that I would look at a client's entire body rather than just focusing in on the one joint that was the problem. For example, if someone came to me post-stroke with a painful shoulder, I would look at firstly which part of the brain was damaged during the stroke. I'll then try and relate that to what I was seeing. For example, if somebody had a stroke in their cerebellum at the back of their head, they may well present with some balance or coordination problems, which I can then look at and treat accordingly. I'd also look to use the neuroplasticity of the brain. What I mean by that is the brain itself isn't a rigid structure, it's quite malleable and can be remoulded in order to open up new pathways and awaken new pathways to get the messages from the area which is damaged down to the muscles and joints in the lower parts of the body. Neurophysiotherapy can improve a whole range of symptoms. For example, you may have floppy or weak muscles, so we can help with that by strengthening them up. You may have some balance or incoordination problems. There may be some issues around tone or spasticity. What I mean by that is sometimes when you have a stroke or have another sort of neurological problem, the muscles find it really difficult to switch off and they're working all the time and they can get very tight. Neurophysiotherapy can help reduce that in order to gain more function. Neurological physiotherapy can help you regardless of how long ago your injury was. For example, with stroke, people tend to think of 3 to 6 months as the optimal time to have your rehab, but actually I have a number of clients who had their stroke 10 years down the line and they're still continuing to make gains with me now. Neurophysiotherapy can help conditions such as multiple sclerosis, Parkinson's disease, motor neurone disease. These are long-term neurological conditions where we would aim to try and help maintain you at the level you're at and also try and see some improvement, particularly with multiple sclerosis and Parkinson's disease.